Let us now go to pathology in Chinese medicine. The topic is relationship between genuine qi and evil qi to pathogenesis. Pathology is the study of the structural and functional abnormalities of the diseased body, from the onset through the course of development to the resolution of the illness. It was first mentioned in the internal classic. The plain question states, carefully observe the suitability of the weather. Do not lose sight of the mechanism of the illness. Again, search diligently for the disease mechanism and treat it accordingly. The 19 items on illness pathogenesis in the internal classic are precisely a summary of clinical practice. These quotes point to the importance the ancient physicians attached to the study of pathology. In CM, the occurrence and course of development of an illness are closely related to the patient's constitution and the characteristics of the causative evils. When the pathogenic evil attacks the body's genuine qi resists it. The struggle disrupts the normal balance between yin and yang, and this disturbance in turn affects the physiological activities of all the organ and tissue systems of the body. In some cases, the ascent and descent of organ qi become abnormal, and in other cases, the actions of visceral qi and blood become ineffective. In all cases, a variety of abnormal changes ensue, whether in the entire body or in a localized region. The study and application of pathology and the mastery of the many changes in the course of illnesses are of crucial importance for the diagnosis, treatment, and prevention of diseases. In CM, the most characteristic feature in the clinical approach to illness is treatment based on symptom analysis and pattern recognition, which requires not only a systematic symptom analysis and differentiation of the pattern of disease in each individual patient, but also the identification of the cause of the illness and its location and guides, the ascertainment of its course and abnormal changes. Only then does the physician apply treatment aimed at the root of the illness. This is known as in treatment, seek the root. Pathogenesis. Pathogenesis is that part of pathology concerned with the study of the mechanisms and principles of the occurrence of illness. What is the relationship between the genuine qi and the evil qi to pathogenesis? So genuine qi is the body's capacity for avoiding and resisting illness and recovery, as well as the normal functional activities. Evil qi, used as the opposite of genuine qi, is the general term for all the pathogenic factors that can harm the body, such as the 6 climactic evils, the 7 passions, the pestilential evils, phlegm, blood stasis, and food retention. In CM, the occurrence of any illness is a reflection of the failure of genuine qi to repel evil qi in their struggle. The relative rise and fall of genuine qi and evil qi not only directly affect the occurrence, development, and prognosis of an illness, but also determine the nature of the disease. In a sense, the course of the illness is the course of the rise and fall of genuine qi and evil qi. Now let's look at deficiency of genuine qi as the basis of pathogenesis. In CM, relative insufficiency of genuine qi is the necessary internal condition that permits illness to occur, whereas evil qi is the requirement for illness to develop. If there is sufficient genuine qi, evil qi cannot prevail. Evil qi can succeed only if genuine qi is inadequate. CM greatly emphasizes the body's genuine qi. In general, when the body's visceral organ functions are normal and its qi and blood are ample, then defensive qi is sufficient to protect the body from invasion by exogenous evils or from illness caused by exogenous evils. In such conditions, the body's yin, yang, qi, blood, and the functions of the visceral organs and meridians are all within the parameters of the physiological state. This is known as the genuine is able to repel the evil. Conversely, if the body's genuine qi is insufficient, its capacity for resistance is weakened, and it is unable to repel evil qi. Alternately, if the evil qi is too powerful, it can invade and establish itself in the face of normal genuine qi. In either case, the body's yin, yang, qi, blood, visceral organ, and meridian functions move outside the physiological parameters. This is known as the genuine is unable to defeat the evil. Now let's look at the second part, where evil qi is required to cause disease. Though greatly emphasizing genuine qi and attributing to it the dominant influence in pathogenesis, CM does not neglect the significance of the pathogenic evils. Being the necessary requirement for illness to occur, the pathogenic evil may, under certain conditions, be the key factor. These conditions include, for example, high fever, chemical poisoning, trauma, and bites by animals or insects. In such situations, even though genuine qi may be ample, illness may be unavoidable. Already in ancient literature, for example, the Plain Questions, there are clear statements that pestilential evils are contagious and that prevention of such contagion requires avoidance in addition to maintaining ample genuine qi internally. This is especially true of those more powerful pestilential evils, which can, under certain conditions, cause disease despite ample genuine qi and even bring about epidemics. Thank you so much for your attention.